We have had the most wonderful. Thank you so much. All right, everybody. Well, somehow it's April already. We have a little bit of a different structure of our meeting today, since we felt like over the course of the last few months, we were kind of getting into a little bit of a routine and thought we'd mix it up a little bit this month. So we have some guest speakers for us, some folks excited to tell us about things that we have going on. And before we get into that, we're going to do a little bit of housekeeping. Jeanette and I have some updates as well, some upcoming events that we are excited to be working toward. Obviously Recovery and Action Committee updates. So I think we should start there because those are so important. So Jeanette, take it away.
Well, again, thank you super much for y'all to be here. We can't do it without you. And I always put anywhere I can, we're just stronger together. So thanks for being here. The Recovery and Action Group, we do have some committed folks who have been spending their time as we are looking forward to planning some social events, as well as some educational opportunities to educate the community. Our last meeting, however, was just one of those days where folks were pulled away. We had someone sick. We had other people that got called into work. So we don't have official dates for those. That is something we're going to be finalizing. We always meet the first Wednesday of the month. So we're excited to finalize those. We are also—
And that'll be May 4th next month.
That's correct, May 4th. We are also, we did schedule, but did have to reschedule. We're going to start using our social media as a live tool to be able to have discussions. And so we were able to reschedule that for the 29th, which is a Friday at 3. We're going to do that live on our link, our Logan County Recovering Together page on Facebook. If you haven't found us, please join and follow us there as well. Other than that, right now, as far as we don't have any official dates, but a lot of exciting news, a lot of exciting energy. Not to mention, Rachel and I got to connect with a mover and a shaker down south who is doing some amazing things. And so we have a lot coming your way. So again, thanks for letting us update.
Yeah, and I will just put a little bit of a bookmark, a little worm in your ear of some dates that we're considering. We are looking at, thank you all for participating in our event vote. For those of you who responded to our email about what sounded cool for a summer event, the overwhelming consensus was let's do something in an outdoor barbecue with maybe some music. So we're working on that. If anyone knows a band or knows someone who would like to volunteer DJ services or something of the like, please have them reach out to Jeanette or I, because obviously every dollar that we can save, we can spend on a different support in the community. So if we have anyone who'd like to help out, or anybody maybe with a personal recovery journey that they might feel passionately about supporting what we're doing, have them reach out to us. But for those, we were looking at July 16th and 23rd, respectively, in Logan and Mason. And then we were looking at, for Recovery Month in September, looking at doing the walk again. It was a really great event, and we feel like we can grow it substantially this year with a little bit more lead time. So looking at the 17th and the 24th. So those are still just kind of penciled in, but want to plant that seed for you now. Don't book your vacation for that weekend if you'd like to come to our recovery walk.
Okay. Let me just, sorry, I do want to take the opportunity and knife in here and just express how important and how valuable your presence at those type of events when you're able to come. It really does impact really allows folks to see with their own eyes the commitments that you all have made. Not everyone gets to see this. And so hopefully when we do have some events, you will be able to attend and yeah, thank you.
And yeah, and there are booth opportunities that are free of charge. So we can provide any assistance you would need with tables or chairs or anything like that. If your organization would like to have a booth at the recovery walk or at our summer event, I will send some more details about that in the coming weeks when we finalize the dates and make sure that we've got the pavilions all set up. That being said, just if anyone wants to be there, please give us a shout. Okay, moving on. We also are going to be, as Jeanette mentioned, with the social media we are launching our anti-stigma campaign over the coming weeks. So that is a huge push for the ROSC. It's a huge area of focus that we identified the need during our needs assessment. So honestly, we all know that we have a challenge, right? In our community, we have a lot of stigma associated with recovery. We have a lot of stigma associated with folks coming forward and admitting that they've struggled in the past. So what we would really like long-term is to have a sort of a holistic approach to supporting people throughout their recovery journey. And that starts with working in the community to help people to realize that this isn't a moral failure. This is something that people do and can, come out of and thrive as long as the community supports are there. So A, we want the supports, and B, we want people to realize that that's possible. So we're excited to be starting that phase of our project as well. Jeanette, did I miss anything on that?
No, I don't think so.
Okay,
You got it.
Great. So next we are going to move to a project that we're really excited to get to showcase a little bit today. Cassie Delaney's here and is going to tell us about what they've got going on. I'm so excited for everyone to know more.
Absolutely. Definitely put us on that list of wanting to attend the walk. We are definitely wanting to increase community awareness, and some of the things that you're talking about is definitely I think important to mental health and just that conversation around it's okay to not be okay. It's okay to have gone through it, make it more of something that can be normalized and appreciated instead of nothing you can feel like you can talk about. So absolutely, we are definitely interested in that. Again, my name is Cassie Delaney. I am new to this group. I am the project director with Memorial Behavioral Health. So I'm going to talk about mobile crisis response. This program, we are rolling out 2 counties at a time. So mobile crisis is currently live in Sangamon and Menard. Morgan Scott is in a few weeks, and then we're looking tentatively, we don't have an exact date, but we're looking mid-June for Logan and Mason. So right now we have a position open for someone with lived experience. So if you have anyone who is, that's in recovery, that's interested in giving back, please tell them that position is open and available and completely in the Logan Mason area that would be serving. So just always have to rep that. So mobile crisis response is a community program to provide crisis services to anywhere. And the goals of reducing ER and jail as the place for people to unfortunately get mental health services. So we know that for like emergency rooms, about 80% of those who go to the emergency room to get a crisis screen or to get a screen to discuss mental health services, they end up going home. So the goal is to try to serve someone where they're at their home. It can be within the community, at another organization. We see people who are just on the streets. So we're able to have someone from the mobile crisis unit, which also has that person with lived experience. They're part of that team approach to meet with someone and discuss what's going on. The criteria for this program is they feel like they are having a mental health crisis. So we're opening up the availability of who can utilize this program. It is completely free of charge. So if they have Medicaid, we can bill that on the back end through Medicaid insurance. If they have private or do not have insurance, then it is billed through the grant. So they never have to have any payment or be responsible for any payment associated to that. It is for all ages. So we serve the whole lifespan, 24/7, 365. So the goal is we can't control when a crisis happens, but we want to have someone who's available. It's going to look like if someone calls a number, and the number is 217-788-7070. If they call a number, and it can be, like I said, a police officer, it could be a family member, it could be that patient calling for themselves. So they can call that number when it is live. And then it is like a dispatch line. They collect the information and then they tell you who will be calling you back. So if Brianna is the one that's going to be screening you, then they will be calling, and they will be setting up a time that they will either come in person, or some people prefer to have a screen over the phone. So we are accommodating to whatever people are most comfortable with. Our goal is to provide a mental health response. We know sometimes police have to be involved, but we try to communicate that as much as possible and try to coordinate with the needs of that person. So it's kind of a change of thinking, and this approach is something that's going to be actually expanded and changed for all counties. This is part of a bigger conversation, a bigger change called 988. So some of you may have heard a little bit about 988, and some of you, it might be new. 988 is going to be the mental health 911. So starting July 16th, it is going to be the number that is live for everyone in every county, in every state of the United States. And that will be the number that will be what the National Suicide Lifeline is right now. They'll roll into 988. So it gives you that person to talk to. And then part of that is to have that mobile crisis response. Now, every county is going to have a different provider or a different ability for response. So I can't speak to every county, but this is the overall goal to increase mental health services throughout the country. So we're kind of getting a jump on it, knowing that it is going to be here before we know it. So the more practice and the more time that we can work in the community and get the word out and help educate and support people who want mental health needs, we know that it'll have a better response.
Thank you so much, Cassie. So you touched on this a little bit already, but it's a 24-hour service. Folks are going to be able to relatively shortly call 988, and they'll be connected with, in Logan and Mason County, they'll be connected with your team.
Yes, we will be the call center. So we will be the call center provider and the mobile crisis provider. Yes.
Wonderful. And are those calls, I'm anticipating there being some overlap with substance, right? But there'd
Absolutely.
So can you talk a little bit about what that process would look like if someone is perhaps having both a mental health crisis and a substance crisis at the same time? What would that person's journey look like with you all?
Absolutely. I think absolutely the biggest part is building our resources and building the community resources to understand what is available to them and be able to connect people with those resources. We know that depending on what the the disposition of the screen is, will depend on what their follow-up services may be. And oftentimes, if they need inpatient substance abuse treatment, then and they're deflected, let's say, from the screen, then we connect them with that facility. So we'll definitely need to build those relationships and work together to make sure that we're serving them in the way that is supporting both mental health and their recovery.
Exactly. And yeah, that brings me really nicely to the next point, which is that as we discussed earlier, we have a really great, pretty comprehensive list of local providers
Yes.
and local supports within the area. And I want to give everyone else an option to maybe reach out to you. Would you put your email in the chat so that anyone who wants to reach out and have a conversation about partnership or any other, it's one of the things that we're really trying to do here with the ROSC in this second year is make sure everyone knows each other and knows what exists and what doesn't exist, and get us out of our silos a little bit.
Definitely. I will make sure to put that information in, and I encourage anyone to reach out. We'll continue to share information as time gets closer, but I encourage you to share information about your programs and make sure that we have everything up to date as people call into 988. We know they're going to call for community resources. That's just sometimes when you don't know who to call, you call someone who's 24/7. So with it being 24/7, we see that it's going to be people that are going to reach out for other needs that maybe mental health is part of, or maybe it's not even mental health, but they know that we'll answer and we'll talk to them. So we are interested in building as comprehensive as a list and be as supportive to the community and up to date as we can be.
Well, I just want to chime in really quickly. Cassie, thank you so much for being here. And just, I have to reiterate how amazing and incredible this, this can be. We've been needing this for a very long time. And I think that those of us who've been here for some time, you said it right, meeting people right where they are, right? And I think that is so valuable. I look forward to supporting this in any possible way that we can, but just have to emphasize, this is a big deal. This is something very different. This is something that has not been kind of our status quo at all here. And so truly excited. I did hear you mention that you have the position open. I just want to touch back on that really quickly just to get information. Does that individual have to come in with their CRSS or CPRS, or is that something they can obtain within their first year?
They can obtain within their first year. That's correct. Yes, and it comes with onboarding and training. We have a pretty comprehensive peer program as we've expanded those positions. We also, which isn't directly in the Logan Mason, but we do have the call center positions for 988. We built half of those positions we want to be peers. So we want peers answering the phone for people calling in. So I think that looking at that peer model is going to make a huge difference with follow-up, but hopefully with engagement as well. More likely to, want to get invested in services and make that change for themselves.
Well, that's great, because that was my second question about who was going to staff, the incoming calls, and being someone who has offered, support, mental health and substance use disorder telephonically. It is so powerful to be able to have a choice or an option to speak with someone with lived experience. And it's incredible what does come out of those conversations. So, those opportunities to be on the call center, in what area would that be?
Right now, the call center is going to be located in Springfield. So it's a Sangamon County for those positions. They're the same way, where they can take within a year, they can earn that certification. And our goal is right now, I think we have 6 positions that are opened. We've had a few interviews. We're hoping to have some interest. And then there's some bachelor levels and some master levels, kind of just to staff that time so that they feel like they can have whichever level is best for that situation, with hopefully the peer being the one initiating most of those calls.
That's awesome. I want to make note how important too what you guys are offering and the difference that it makes. And I think some of us can begin to advocate, hopefully, for these type of opportunities. We have some really great avenues to reach the CPRS and the CRSS now, whether it be the Heartland package they put together, DHS has an avenue, IABDACTA has an avenue, but the one struggle is having the required supervised hours. That is a pitfall for a lot of folks. Because some people have had to do it volunteering their time, and it's taken them a significant amount of time. So I just want to say bravo that you guys are opening up that way and creating that space and opportunity for people to earn that credential and have that experience. So exciting stuff.
Very exciting. More to come, and we're looking forward to getting to serve the community. And they say it's been like 30 years since we've had such a big change in mental health, and it's really exciting to be part of seeing what it's going to be like to serve so many different people. So I appreciate getting to talk a little bit, and please, I'll put my information in and reach out. I'd love to have more conversations.
Hi, Cassie. Apologies if you already answered this, but somebody put in the chat, are you guys going to expand to Fulton McDonough counties at all? And if not, can you share information how they could get that in that area?
I did not see that, and thank you for bringing that up. So right now, we actually just had this conversation yesterday. The state is making a list. So we actually don't know who's covering other areas. We only know the areas that we are assigned. So there was a grant that went out, in different community mental health and other agencies got part of that grant. And so that's how they were able to split up the areas. I will share with this group as soon as they give me that map. They say they're working on it, and they did not give a time frame, but I absolutely, we want to know who our area handoffs are for the best, continuum of care. We want to make sure that we're connecting them to the right people and having the right information. So that is a top priority on our list, and we will share that as well.
Excellent, thank you. And then I am the Regional Leadership Center. We have a team across 33 counties that cover Department of Human Services Region 4. So once you get that list, we can maybe talk about which of our people cover those areas, and we might have contact information that we can pass along or that kind of thing. So we can talk about that in the future.
Yes, that would be great. Yes. It would be really good to know who serves what area. For anyone who's going over multiple counties, there's going to be multiple coverage areas. So we absolutely want to serve everybody in the best way and get them connected and make sure everyone has the most up-to-date information.
Awesome. Thank you so much, Cassie. Before we move on, does anyone else have any questions about this really awesome new program? I'm personally very excited about it. I think it has the potential to help a lot of people and to touch a lot of the folks that we serve. So if anyone has anything that we haven't touched on and they would like to bring it up.
Are you going to put your email in the chat, and is that how we would get a hold of you to apply?
Yes, I will put it in right now. And yes, I will make sure that, always feel like you can send me an email. And yes, I will link those jobs opportunities. I just got that. I will include that as well. We are interested in sharing any information and also hearing about what services are available. So please share.
Thank you very much.
Awesome. Well, if we don't have anything else for Cassie at this time, Jeanette, are you all ready?
There we go. Am I ready?
Yeah. Do we have another guest speaker for today?
We do. I'm so excited to have Tristan join us. Tristan is in Mason County area, and he has so much fire in him that he even came to one of our Logan Mason. I drove down and met us here. And actually I was able to go see where his neck of the woods, and he took me around and toured me around. He's doing some incredible things in his own community out of out of him saying that it just needs to be done. So if we can just welcome Tristan, and if you want to just share a little bit, Tristan, we'd love to hear from you.
Thank you, Jeanette. I appreciate it. Cassie, that all was awesome. I like to hear that. I mean, it's as a, recovering and going through the process here in Mason County, I was very lucky to be able to get into the Gateway Foundation when I was able to. And it was something that, I'd love to pay back. It's just, it was there when I needed it. And I've had friends that I've been trying to help and things, and there's really nothing around here and when you're trying to help and things, I was looking to start a meeting and things, and I've been looking to do it for a long time, but it's the stigma. The people don't, it just dead ends every time I tried to go. So eventually I had enough friends and I just said, here we go, we're going to do it. And we've continued to do it and just have a sober activity for my friends and whoever wants to attend, to just come up and stay sober and lean on one another to get through this. As anybody knows that's been through it and dealt with it, that it's not easy, and working together is the main thing. And having people to have your back and things like that. But Mason County, we definitely need some help. It's all rural area. It's totally different than the city. Being in Springfield at Gateway and stuff, it was amazing to have that there, and to have something around here similar would be just to let the people know that there are things available to them. That's the biggest part in this. But other than that, no, everything sounds great, and the way this is going is amazing. Thank you for having me. I appreciate it.
Hey, Tristan, do you mind sharing just some of the activities that you guys have done just to get together?
We've actually just we've rented there's an old gymnasium here. We've had some generous donations and things, and people in the community that have anonymously donated to it, and we just kind of go up and meet and talk and play basketball, shoot around, do whatever. It's kind of an event in the evening to do something. And we've also met at the gym, kind of working out and that type of thing too. So just replacing those bad habits with better ones. So that's what it's about. So
Thank you, Tristan. We appreciate you sharing and just your heart to do what you're doing. He's been a little modest. What I understand is the whole idea started with him coming out of his own pocket. So that is the motivation that lies in folks who really want to keep it. And we know we keep it by giving it away. So again, thank you for being here.
thank you all so much. I appreciate this.
Yes, thank you, Tristan.
Thank you, Samantha.
I really value the opportunity for you to share, Tristan. I think I speak for everyone and say that we're really inspired by the initiative that you've taken. And these are the kinds of stories that we want to give a chance to highlight, because as we've said 100 times, if we've said it 1,000 times, recovery is possible and it happens together and we work together. And these are the kinds of things that can happen. I apologize for my little one in the back.
No, you're fine. You're exactly right. And that's, working together, and I've noticed there's not a lot of people that's willing to come out and say what they've dealt with and the struggle they've had. And that's just something that growing up here, people know me, and it's just, this is who I am. This is what I've come through. This is who I am. I think we've all had struggles. Anybody that's been there knows that that's a tiring process, and it's just eventually you become wore out, and to have somewhere to turn and to teach you actually how to live again is amazing. It really is. And like when Cassie was talking, I had chills 90% of the time, because it was just like, this is awesome. This is what you can lead people to. But thank you very
And
much.
yeah, and to get to tell people you're not alone. There's a whole bunch of people here that want to help. And here we are, we're, this is how you get in touch with us. And for us all to know the ways that the help is available, the different methods of assistance that exist in our area. And I think it's really inspiring to see the growth of those services and supports just in the year that we've been around. So thank you all.
That is, you're exactly right. And I also want to say another thing. I just want to say hello to Becky. I haven't seen you for a long time. Good to see your face.
You too, Tristan. I'm glad that you came today.
Thank you.
Want to can I just add, as we're talking about resources and just some of the amazing things that are happening, again, I want to bring attention to the fact that SIU is here in Lincoln now with the MAR program available to folks. And that is a big deal as well. Options is so important, and that we have that option here. I just always want to make sure I mention it in every room I'm in, because of how a lot of folks have put some work into, right, to get that here, and the folks willing to come, Camille and others, to be a part of helping our community in such a way. So just want to make sure to reiterate that that is something that is available here in Logan County as well. And through, yeah.
Wonderful. Well, we have about 15 minutes left, which is the perfect amount of time for us to go around, and any updates in your organizations, any exciting things you would like to share that are going on. Now is the time to do it. Anybody have any exciting progress, exciting new thing or something? We have some new faces. Anything you want to make sure we can showcase that everyone knows about?
I don't know. This is Rachel with the Salvation Army here in Lincoln. We do have someone by the name of Jeff Gray who did recently go through a relapse prevention program on his own, and has now started to do support groups in our building here, specifically with the veterans. So that's something new. I didn't know, is he already part of the same peer support specialist program? As if not, it sounds like he'd be a perfect candidate.
Yeah. Hey, Rachel, this is Jeanette. So glad you're here today. And I'm glad you brought that up, because that is something I forgot to mention. Jeff is part of the peer, or the recovery support through Heartland. So that's the classes that he's taking currently. But yes, Jeff is someone else who, in his own initiative, has stepped out to begin a recovery group for veterans. And the Salvation Army has been so gracious to walk alongside and allow that space and place to happen. We have come alongside to help with things like marketing and creating flyers, as well as providing materials, literature, to get started. So we were able to get a couple sets of all of the AA information, as well as even coins and whatnot, as well as NA coins and all the materials and literature for that as well. So thank you, Rachel. That slipped my mind, but that is something new and exciting that is happening here. And again, it's coming from someone who sees the gap, who has lived the experience, and who is stepping up to the plate. And so it's an honor to walk alongside with him as well, and support. And again, Rachel, thank you so much, and to the Salvation Army for allowing that opportunity to take place there at your spot.
No problem. And we are open for other groups. He's here on Mondays and Fridays. So we're a community building. So if there's any other times or opportunities that are needed, our building is open for that.
Awesome. I'm going to keep that in mind.
And
For
we do have
possible
additional
review?
funding available for materials and things like that. If the ROSC can support in any way, if you or someone you know is wanting to start a group or would like support in that way, we do have some.
Did you have something? Sam, were you about to say something?
Oh, I just said like space for like possible events, like maybe speaker jams or maybe like a dance or a dinner or something like that. Is it like a big space?
We don't have a lot of space. We do have some space. We could do a small dinner because we do have a open kitchen. We did, and there's like the small kitchen that's a shared unit right now. And we have a couple of tables on the dining common side for the veterans that could be available, as well as our general community room. So it kind of depends on the number of people.
Okay, thank you.
Mhm.
I did just see a question about MAR, the MAR program. And so, hi, I'm Camille, just in case. So the MAR program is within the SIU Family Medicine Center, which is located in the Logan County Health Department. And this is for any patients who have opioid use disorder that are interested in being in treatment. And so we use actually Suboxone as a part of our program. And we also have a behavioral specialist, Kat. She's also on the council, wasn't able to come today. And so as a part of our program, we're able to see a physician, and then also counseling is available as well. And so that, like I said, that is located in the Logan County Health Department. We are definitely accepting new patients still. The program just opened up in February. And so I will put the number, the phone number for if anybody has any patients or anybody who's interested, I will put that phone number in the chat.
Would that also be for, so if we have clients that we know coming in with current, like if they're in withdrawal currently, would we be able to refer them to you as well?
Yes, absolutely. If they are an opioid withdrawal, yes, absolutely. We'll be able to see them, and they most probably will be able to get an appointment that same day, but yeah.
Okay, perfect. I know we recently had, we don't get as many of those people in, but I think now that we have a sign outside of our building, we're getting more people coming in. And we've had a few more of those calls coming in.
Yes, absolutely. So yeah, I'll put that phone number in the chat, and then I can also put my email address as well. And yeah, if they're having lots of people, then we can maybe try and figure out a workflow of how we can easily get those patients into the clinic.
That's awesome, Camille. Thank you so much for being here and bringing some clarity to that. And again, just some exciting stuff that's happening here. So.
Oh, thank you, Randy. That was the last thing I was going to mention. We have Drug Take Back Day coming on April 30th. Do you want to talk a little bit about the locations?
Yeah, I'm not quite sure about Logan County. For Logan County, we are giving them these DTERA bags. So it's a DTERA drug deactivation system. So these Logan County Health Department will have 50 of these available for DA Drug Take Back Day and moving forward. We were able to secure a grant to provide these. So these are pretty cool. It's just a bag that you can take home. You rip off the top and it has some stuff in it where you add up to 45 pills of any sort, add water, shake it up, and you can throw it in the garbage. So it's a safe way to dispose of medication at home, so that you don't have to wait for these drug take back days or drive to the sheriff's office to use the drug take back box. So very easy for seniors to do and everything like that. So we'll have those. And then in Mason County, Grace and I will be going around with the sheriff to different locations around town. So we're going to like Mason City, IGA, Oni's, and the Manitou Lodge, I believe. Correct? Okay, perfect. So we're going to be at those locations giving away DTERA bags as well as collecting any bulk prescriptions that people want to bring in. Those are no questions asked. Just please do not bring any syringes or anything like that. We are not able to take that back, but we can take any prescriptions, and please take off any labels or anything. We do not need to know who it was prescribed to or anything like that. We just want them like in a baggie or something like that, so we can easily dispose of them. On another note, thank you to everyone that was able to come to my presentations for the needs assessments that I had done in Logan and Mason counties this month. I will be doing an encore presentation of the Logan County presentation this coming Monday at 9 a.m. via Zoom. So if anybody would like the invite for that or know anybody that would like to attend, it'll be about 30 minutes of me presenting on the data from that needs assessment. I have it all in a PowerPoint, and about 30 minutes of discussion doing community action planning. So we're going to look at those gaps and barriers that I identified, and we're going to brainstorm some ideas of how to fill those using the community resources that we already have, teaming organizations together, as well as what the state can do to help us out, whether that be more grant funding, loosening restrictions on certain grants, that kind of thing. So I'm open for any feedback people have about that. And if you did not get that original email, I can definitely send it on to you. I sent out a couple different times, so I know I don't have everybody on my distribution list. So just let me know if you have anything to contribute to that.
Hey, Randy. So my work email is attached to this. Is there any way that I can get like my work and my personal email? Because if I'm not at work, like I don't have access to my work email.
Yeah, definitely. Do you want the invite for the meeting on Monday?
Yes, ma'am, to my personal one, if you could.
Yep, I will send that along.
Okay, thank you.
And Denise, I'll send it to you as well.
I have another question for Cassie that just popped in my head. Cassie, is there any talk of a living room?
So in the Logan Mason specific area?
Yes.
Yes. So we are definitely looking at hopefully being able to expand that service. I know there's a few different phases of the next few years of crisis services, and one of which is to turn our current living room and expand the hours even more, and then look at expanding areas. So I know they've seen the living room as a successful model, and we've seen people utilize it. So I hope that we will continue to be able to expand it to areas where people can utilize it that don't have to travel as far.
Yes.
Is there anything else that's going on? It's someone, a victory you've had, something exciting you would like to share, a horn you'd like to toot? We'd love to hear from you.
Just wanted to throw a plug out there too. I know that a few of you on this call already attend, but the Butterfly Project, if anyone isn't familiar, works with Logan County in addition to Livingston, Ford, Woodford, and McLean. And we have a coalition meeting kind of similar to these meetings that we meet every other month. And it's all about community gathering, getting together, supporting the community as a whole. The Butterfly Project provides counseling and case management services for children and families with exposure to violence. And we typically work with the child and their safe caregiver. It's a little bit more of the recovery stage, but we're always looking for additional community partners to join us in that coalition so we can continue to best serve our community in all the areas that they may need support. So if anyone is interested, I can put my email in the chat. And if anyone's interested in joining us in that too, we'd love to have you there as well. So we're a little new to the Logan County area, and we have quite a few families. So we're excited to be making an impact in the community as well as the rest of us on this call. So we're glad to be a part of you all.
Thank you, Abby. And may I ask, are there any opportunities there for someone with lived experience, someone who may have gone through that and be there? Or is that, if not, is that something maybe I could drop the seed and suggest that it be talked about? Yeah.
That's a really good question. That's not something that we've ever talked about, but it could be a good idea. I can definitely bring it up with my supervisor because we usually kind of like collaborate with those types of things together. and kind of see where we go with that. And if she has any questions, maybe I can schedule a chat with you and her and and we can kind of talk about the benefits of that and why that might look like a good idea. So thank you for bringing that up.
And I would absolutely jump all over that opportunity. When we start thinking about peer support, we have the data. It shows us the shift and the outcomes are more positive and greater when there is peer support walking along. And when we think about that expansion, thinking about someone who has walked through that, but part of their journey, they didn't have their kids for a while and had those experiences, but have come back and now is walking out recovering, how powerful that individual could be for those families, as well as Center for Youth and Family Solutions. That's another place that I'd love to kind of plant that seed. But thank you for just your openness. And again, I'd be willing to talk anytime about that. Well, all right. It looks like we're 3 minutes out.
We are.
We don't mind giving you 3 minutes back of your afternoon. If no one has any questions, comments, if you'd like to stay on a little bit after, I can hang out, Rachel. But we are grateful that you're here. Next meeting, Rachel?
Next meeting is, our date is going to change next month. So we're going to meet on the final Thursday of the month, which I believe is the 28th. Let me just double check that. And obviously it'll go the 26th. The 26th is the Thursday. So we will obviously send an updated link out for everyone. But please spread the word if there's anyone that should be here that hasn't had a chance to join us, or that maybe was here in the beginning and should come back. Next month, we're going to do little work groups, and we're going to have some fun with event planning. So if we know anyone that's great at that, please send them our way. But we're really grateful to you all. We're going to be reaching out individually to those of you who have asked us to, or who have perhaps volunteered for our social media campaign. And that's a really exciting new phase of our ROSC project.
All right, everyone. We hope you have a great afternoon, and don't ever forget, the work that you do matters. So thank you.